All right, welcome back to Revive Your Health podcast. I am here as your host, Dr. Shannon, and I'm here with Dr. Stephanie, PharmD.
Hello.
So this is a special podcast episode. We are going to be doing a part 2 on our last episode, which was all about autoimmune disease. So Dr. Stephanie, take it away.
Okay, yeah, my name's Dr. Stephanie. I work at Revive Chiropractic with their metabolics program where we do some functional medicine testing, nutrition consults, all of that. I am a pharmacist, and so I have found my way over into functional medicine. Like, I feel like many people that have found their way to functional medicine, it's mostly from just their personal experiences. So I had some health issues with my cycle, GI issues, always tired, and did various testing from my thyroid to sleep studies to, GI testing the medical way, and nothing ever showed up as anything significant. And so I was always very into health in general. I mean, getting into a healthcare field. Mm-hmm. And so knew nutrition was important, became a patient at Revive Chiropractic, and was learning more about diet and gut health. And that just led me down the road of seeking out help through more functional medicine practitioners. And I did testing with Revive when they started their metabolics program that revealed a mold toxicity issue.
Okay.
And sure enough, the house that my husband and I were living in at the time was an old farmhouse. I never really thought of mold being an issue. I mean, I knew mold wasn't great or clean, but never thought of how it could truly affect your health other than maybe like allergies, sinuses. But living in that house, I had even started to get like migraines and things just weren't getting better. And so there was that. And then the home I did grow up in as a kid also had some mold issues. So I think it all had just kind of compounded.
So if you don't mind me just interjecting real quick. So you were a pharmacist.
Yes.
And how long do you feel like into your either schooling or your career or whatever did you, I guess, start to notice some of those issues you mentioned about, your cycle and just overall well-being? Where did you kind of find those issues? And then what did like your medical doctors do to, I guess, help you or try to figure things out? Because nothing came up on tests, right?
Yeah. And I think with most bigger health issues or things that are chronic, once you kind of get to the root cause and figure them out, once you look back, you realize how early on a lot of those things started. I mean, I often would have colds and get sick when I was in college. I would get pretty seasonal sinus infections. And at one point they did say like, oh, I think you have bad allergies, which it was probably like mold and mold allergies and sensitivities. And it was definitely my last 2 years of college where I really noticed being tired all the time. It didn't matter whether I slept or not. I would struggle with things like constipation here and there. And anything that you deal with long term like that, I feel like just becomes your normal. And you don't often stop and question it. You're like, oh, well, this is just how my body is. I have just always been this way. I'm just always tired. Or sometimes I just get constipated. Like, it's no big thing. It's just how it is.
Yeah.
But oftentimes, there is a cause, as we know, and there is something going on. And oftentimes those things, if you don't try to get to the cause or address them, it'll just compound into bigger things. And so,
absolutely.
Like with the fatigue, I had my thyroid tested a lot. I did a sleep study where I slept overnight, and then they had me stay, and they have you like lay down to take naps to see how quickly you fall asleep. It's called a sleep latency test. They'll do it a lot for like diagnosing narcolepsy. And they're like, well, you fall asleep as quick as someone with narcolepsy, but in narcolepsy, you'll go straight into REM sleep.
Okay.
And that's part of like the definition or full diagnosis of it.
Okay.
But I did not go straight into REM sleep. So they're like, so you don't have narcolepsy. They're like, but you're obviously tired all the time. You could obviously fall asleep quickly. So you have idiopathic hypersomnia, which basically means it's a fancy way of saying you're really tired all the time and we don't know why.
Yeah.
And so then the solution was, let's try you on Adderall or Ritalin, see how that helps. And at the time I just wanted to not be so tired and feel better.
Yeah.
So I tried those things. And like the first 2 weeks felt amazing. And I was like, well, is this what regular people feel like?
Yeah.
To have like normal energy and focus and things. But then the effect would wear off. And so then it got into the game of, well, try this medication or increase this dose. And being a pharmacist, I was like, I know where this goes and I don't really want to play this game.
Right.
So I just kind of stopped and then started to look more into the holistic approach for like what's going on, like looking at my gut health. I'd gone gluten and dairy free, and that had made a pretty big impact in my overall well-being. But there were still some things like the fatigue and my cycle that still weren't where I wanted them to be. So I'm like, I know there's something else. And so that's where the mold testing and everything came in. And once I addressed that, saw a big change.
Yeah, that's amazing. And I will say, like, just to comment a little bit on the fact that, they just didn't know why you were getting tired.
Yeah.
And then they kind of immediately pointed you to Adderall and Ritalin, which is like a class 2 drug, right?
Yeah.
Which
controlled substance.
I mean, that's
can be
kind of
addictive.
crazy, right? It can be.
Yeah.
So, like, depending on who you are, like, that could be a really dangerous thing to kind of go into.
Yeah.
You know, not to say that, you know, whatever.
Right. Yeah.
But for someone that's not diagnosed with ADHD or anything like that, and just kind of saying, oh, well, you're tired, here you go.
Yeah.
Feels pretty good, right?
Right. Yeah. And it is definitely easy to, obviously there's huge faults there, but a lot of that just goes back to, you have to look at the medical community and the schooling, and it's what they're taught. Here's, the diagnosis, here's the prescription or the surgery for it. That's mostly what they're taught. They get minimal courses on nutrition.
Yeah.
I doubt they get any courses on toxicity or even talk much about like mold, environmental toxins and those types of things. So it's a unfortunate gap in the medical education.
So how common do you feel like mold toxicity is in our culture after being in functional medicine for a little while, and even you still work as a pharmacist a couple of days a week. So how often do you see it on a regular day-to-day basis?
I feel like it's more common than people think. And I think mold is one of those sneaky things because, again, I don't think most people realize it. And the other thing is I think it's about 25% of the population, their bodies, again, like I know you guys talked about epigenetics, like their genes affect how their body is able to recognize mold and the mold toxins it creates. So that's a part of the problem with mold is it's not just the mold itself, but certain molds create toxins.
Yeah.
And then those are also in the air and you're consuming them. And so a certain percentage of the population, about 25%, their bodies don't flag and tag mold and the toxins in a way that can get them out of their body. So like my husband and I, we were living in the same house. He wasn't having migraines. He wasn't having the kind of health issues I was. He was just more congested, a little more sinusy. Yeah. But he has a deviated septum, and so he's also like, it's kind of my normal, could be structural. I mean, once we moved out, he was like, yeah, I guess I was a lot more congested than I realized. But again, I was starting to have like ocular migraines and different things, and he was not. And that just shows different people are going to respond differently.
Yeah, absolutely.
And so I have seen that a lot in a lot of the people that I'll work with where we start to try and uncover like what's going on, and they're doing all the right things, like making some lifestyle changes, working on gut health, minimizing toxins that they can, but things still aren't improving.
Right.
A lot of times that's when I look to mold because it could be a current exposure, or it could even be an exposure from years ago, especially if you're the kind of person that really can't process mold out well. It could have been an exposure, 5 years ago you worked in a water damaged building, or the school that you went to was water damaged. I think I've read recently there was one of the dorms at a local college that has had a pretty big mold issue. And so, older buildings, water damaged buildings, that's a great place for mold to thrive.
Yeah.
And it can be hidden behind drywall. It can be hard to see, but it can still be in the air, in the HVAC, and you're getting exposed to it.
Yeah, absolutely. That actually kind of is a great point that you bring up, that people are exposed dependent on their, genes that
Yeah.
get triggered, right? So last episode, you mentioned a little bit, we were talking about epigenetics and how different lifestyle factors can influence those genes to turn on autoimmune disease, and then taking care of yourself and, those lifestyle factors that could influence autoimmune disease and, going in the direction towards health can really help prevent it. But what about those people that are doing all of the right things or seemingly doing all the right things and they're still getting nowhere? That's a really great point to say, you know what, maybe we could utilize a little bit more testing, which kind of points me into my next, direction of what type of testing is out there for mold. What have you found to be the most beneficial? And what kind of testing do we have to offer?
Yeah. So in regards to mold, there's urine testing that you can do that will identify mold toxins in your urine and let you know, have you been significantly exposed to mold? And based on the mold toxins that show up in your urine, then that you can relate it back to the type of mold that you've been exposed to and figure out then the common sources. Is it a water damage building? There's certain food groups, corn, nuts, seeds, certain things that can be more moldy. And if you are someone that's sensitive to mold, it can start to build up from just eating a lot of those foods. So that's one way through urine testing. There's an eye test called the VCS eye test. That's testing your ability to see contrast. So to see shades of gray. So like if you don't see well at night, if you have poor night vision, you don't see contrast very well.
Yeah.
And biotoxins, mold toxins being one of them, lime, there's certain algae that produce biotoxins. They can affect your optic nerve and your ability to see contrast. And so it's just a cheap online test that you can do. It's like $10 or $15. And if you fail that, that's a good indication that there's some type of biotoxin. I'd say mold tends to be more likely unless you know, like, yes, I had a tick bite. If you have a more known, I could have been exposed and had Lyme disease, more likely than not, you've been exposed to mold. And so then that lets you know that's something that you need to address. But then we have a lot of other testing that we can do at Revive. GI testing is a big one. So looking at, doing a stool test so you can look at your gut microbiome. And that's really a beneficial place to start, especially if dealing with autoimmunity, because so much of our immune system is housed in our gut.
Yeah.
So if our gut's inflamed, if it's not healthy, if you have an imbalance of the good bacteria and the bad bacteria, that's going to cause a lot of stress and inflammation in your gut, and that's going to affect your immune system. So doing a stool test will look very in-depth at your gut microbiome. Is there gut inflammation? And then it lets you know what probiotics do you need or do you not need? Do you need to go through a cleanse to remove bad bacteria? It tests for parasites. And so that's often a really good place to start for most issues because so many things start in the gut. That could be a whole nother podcast about the gut and gut health.
Yeah, absolutely.
Another test that we will recommend people start with is called the metabolomics, where we're looking at lots of different things. It does do a little snapshot of gut health, but it's looking at it in a different way. It's a urine test and then a finger prick. And so when our bacteria are digesting and breaking down the food we eat, they make certain byproducts. And so that's what we're measuring in the urine. And if those are elevated, that can indicate an overgrowth and some inflammation in the gut. But the test also looks at vitamin deficiencies, B vitamins, which are very important for many different things, mineral deficiencies, amino acid deficiencies. Are you getting enough protein?
Right.
Amino acids are important for neurotransmitters, hormones, all of that. Has a toxicity panel and a heavy metals panel. So it's kind of a good test to start with if you're not sure what could be causing your issue, because it could be nutrient deficiencies, it could be toxicity issues, it could be gut health. And so this kind of gives a snapshot of all of those so we know where to sort of start. And then as we're working through those things, depending on how things are improving, we'll have a better idea of, okay, we need to zoom in on gut health or we need to zoom in on toxicity with more testing there.
Okay. Yeah, I mean, those are two very, very comprehensive types of tests. And it sounds like it allows you to go in which direction first.
Yeah.
What would you say is the first recommendation that you would give to a patient after getting those, like the testing? I know it can be kind of, different per person, but we talked a little bit about nutrition last time. And I honestly just want to hear a little bit more from you because you do this all the time with patients is let's do a nutritional protocol for someone that's struggling with autoimmune disease. And we talked a little bit about last time, some of the more restrictive diets like the autoimmune paleo and Mediterranean diet a little bit, but I feel like that's a little bit more overarching. There's some bigger ones that are really popular right now, like keto and carnivore. So we talked a little bit about that and why some can be beneficial here and there. I just kind of want to hear it from you. Like, what would you recommend to somebody that feels like they're doing it all, but not really?
Yeah, and it's always a patient case by case, depending on what their symptoms are. Certain diets might be better to try first. One thing I wanted to mention too with like keto and carnivore, the one thing I didn't mention with the metabolomics test, it does have the option for genetic add-ons. So to look at SNPs, like you talked about, there's certain genes that can be upregulated or downregulated. So it looks at 4 different ones. One of the ones that it looks at is called ApoE, and that has to do with your body's ability to utilize cholesterol in a healthy way. And so if you have a certain variation of ApoE, keto and carnivore are not going to be your friend.
It's really interesting because as a side note, and then I don't know if you've ever heard this before. No, I think I did tell you. Is the APO4 gene like a snippet of that? Or is it just the APO?
Yeah, no, it's the APO4. If you have the 4 marker, then keto and carnivore are not going to be good for you.
So I actually tried it, the more keto carnivore in 2017, right when I first started to get into more health conscious and my fitness and all that stuff. And it was very interesting because, through the process, I did get blood work done. And my markers in the beginning were pretty okay, but at the same time, it never really went into depth like the metabolomics test would, right? So this was just typical blood test that you could get at your PCP's office, just kind of looking at a comprehensive view. Just tried the carnivore diet, keto type diet, and my cholesterol went up to over 1,000.
Oh, wow.
Which is really interesting. Total was over 1,000. And I had doctors looking at me like, what?
What's wrong with you?
But at the same time, you're not overweight. You don't look like you're struggling with any type of problems or anything. You don't seem to have your blood pressure's normal. All of that. And I got the results back and I was tested 3 separate times to make sure that this was correct based off patient demographic. So it was really interesting. And then kind of once I got away from it and did just more of a Paleolithic type of diet, totally normal.
Yeah.
So that's very interesting.
Yeah. Did you do the ApoE?
I actually haven't tested it yet, but that's kind of...
I'd be curious to see.
Me too.
But yeah, because if we see that show up, then we know for that patient, I'm not going to recommend that you do keto or carnivore. At the same time, though, I'm not going to tell them to go low fat because also if your cholesterol goes too low, you're not going to make hormones appropriately. Your memory is going to suffer in your brain health. But just all of that to say, keto, carnivore, certain diets are not for everyone.
Yeah.
And they can have their place, but if you respond like Dr. Shannon, or if you see maybe your cholesterol doesn't go quite that high, but it's starting to go up a bit, if it is getting into, if it's starting to get above 300, then, maybe you need to back off of the keto and carnivore, and maybe it's just too much fat. Even if it's good, healthy fat, depending on your genes, you might not be able to handle it as well.
Yeah. Slight interjection, I guess. I want to hear your take on cholesterol because I feel like I have so many patients that come into the office, and this could be a whole nother podcast too, but just a little interjection because it was something that we mentioned, but why is cholesterol okay? Not in the terms of being over 1,000, but tell me about that. Tell me what you think.
So cholesterol. You have to have cholesterol to make your hormones. If you look at the steroidogenic pathway, so that's how our body makes hormones, it all starts with cholesterol.
Yeah.
So I've seen studies and other practitioners talk about if you're LDL, so not your total cholesterol, but your LDL, which often gets classified as the bad cholesterol.
Yeah.
If it goes below 150, especially for women, because we have a lot more complex hormones and things like that going on, especially for women, if it gets below 150, you can start to have issues with your hormones.
Yeah.
And so the other part of it, not just hormones, but then our brain, like 80% of our brain is made up of fat. So if we are not eating a lot of good, healthy fat, we're not nurturing and feeding our brain. And we're seeing a rise in hormone issues. We're seeing a rise in Alzheimer's. And I think a big part of that is this desire by the medical community to drastically reduce cholesterol. And the thing with cholesterol, too, is it's not necessarily the bad guy. A lot of it is looking at everything in a big picture. I think one of the things it's hard with medicine and the body because the body is so complex.
Yeah.
And so in the typical medical model, many things have become compartmentalized. We have a cardiologist, we have a GI doctor, we have this. It's all separate, but also all of our body works together, and there's a lot of interplay. And so we're kind of losing the fact of, okay, we're trying to look at cardiovascular health, but then we're really driving down cholesterol, and we're not looking at things in the big picture. And we're also not looking at lab work in a big picture. We're just looking at what's your cholesterol at. Well, you also want to look at inflammatory markers.
Right.
If you have a lot of inflammation going on in your body and your cholesterol's high, that's not a good recipe because then that cholesterol is going to become oxidized. That's where you're going to get more plaquing. You know, if you're diabetic and your blood sugar is really high, it's when that sugar and that cholesterol combines, becomes oxidized, and forms that plaque. So it's easy to just look at cholesterol numbers and be like, oh, those are too high. But what's the big picture? What's everything else look like? Is this a person that is healthy, is exercising, is eating good healthy fats like avocado and nuts and seeds and eggs?
Right.
Or is this a person that's overweight, going to McDonald's all the time, has diabetes? Those are different situations, but I feel like they are trying to look at people the same of, oh, your cholesterol's gotten to this point. Doesn't matter all the rest. This just means you need to start lowering it, whether through medication, diet changes, but usually they're recommending a medication.
Right. I mean, because people have very little faith in, patients to go and be compliant in terms of nutritional changes. But at the same time, it's like when you go to the doctor, a lot of the times their nutritional recommendations aren't going to be super in depth.
Yeah.
So they can be kind of difficult to apply. And I totally have empathy for people that like really truly have no clue where to go because there's so much differing and opposing information out there that it just people get so overwhelmed. They're like, I don't know where to start. Maybe I just want it all. So there you go. I'll take my medication and that'll be it.
Right.
Right.
Yeah.
But that's a great point.
And I would say one thing that people could ask their doctors about, there is a lipid panel. It's called the NMR. And I'll be honest, I can't remember right now what NMR stands for.
That's okay.
But the NMR panel is a different way of looking at your lipids and your cholesterol. They look at particle size.
Yes.
So
I love that test.
With your cholesterol molecules, for trying to, I guess that's the best word, your molecules, cholesterol, they are supposed to be these nice, big, fluffy cholesterol particles because one of the things cholesterol does goes through the body and your bloodstream, and it'll mop up toxicity. Our liver is what's in charge of cholesterol production.
Yep.
Our liver is one of our main detox organs. So that all makes sense. Of course, our liver is going to increase cholesterol, send it out into the body. If there's a higher level of toxicity, it needs to mop it up. So we need to have these big, healthy particles to be able to do that. But if our cholesterol gets oxidized, it becomes a smaller, denser particle.
Yeah.
And a small, dense particle it doesn't have the capacity to mop up toxicity.
That like sticks.
Yeah. And it's also going to stick to your artery walls and cause issues. So the NMR panel will let you know not just your LDL, HDL, your levels, but it'll let you know how many particles you have and the particle size. So then you can gauge it's another way to look at your inflammation, the level of oxidation of your cholesterol, and is your cholesterol being high, is it a concern, or is your cholesterol on what they consider the high side, but you've got the good, healthy, fluffy particles that you need.
Absolutely.
And another thing with cholesterol, and if you feel like you're making diet changes, you're working out, you're doing a lot of the right things, but your cholesterol tends to be high, I would look at your liver and your liver function and maybe starting to support it with milk thistle. And there's lots of great herbs out there.
Yeah.
Because again, our liver is in charge of pushing out cholesterol. And if there is a higher toxicity, and so looking at your liver, looking at, are there toxins in your environment? Do you need to look at how your water is filtered, your cookware? That's a whole nother podcast.
Yes.
So you talk about toxicity.
Absolutely.
But just a nugget, if you're doing all the right things, your cholesterol is not going down, consider liver function and toxicity as kind of a root thing to look at.
That was a great kind of transition from cholesterol to let's talk about toxicity, and there could be an issue with the liver. But jumping back a little bit to nutritional protocol and everything, what is your, outside, I guess, of the gene snips and for that niche example that I gave on, my experience, what is something that you see a lot with patients? What do you recommend? Let's talk about that.
Yeah. I mean, I always recommend starting with cutting out gluten and dairy if the person hasn't done that already, simply because the gluten, protein, and wheat can be very inflammatory. Studies have even shown that the way gluten can bind to receptors in the gut, it'll cause the cells in our gut to kind of become open and leaky.
Yeah, we talked a little bit about that last time too.
Yeah, and so when that happens, then that can be a big trigger for autoimmunity. Gluten can cause, various other reactions. A lot of people, I think, when you start talking about eliminating foods, they automatically think of how does their digestion feel with those foods, but it's so much more than that.
Yeah, definitely.
Like a lot of people will be more tired or have brain fog with gluten. I know if I've had too much gluten and then I go to work out, my muscles are exponentially more sore, just that increased inflammation in the body. And then with dairy, the casein protein, for a lot of people, they have issues with the casein protein.
I've heard that too. Yeah.
And so I've tried, the good grass-fed, high quality dairy and all that. And for me, it just still causes a lot of congestion and inflammation. But I'll recommend people cut those out for 30 days because that's about how long it takes for the inflammation to get out of your body.
Yeah.
And then you can slowly add them back in, see how you respond. And a lot of that, I always tell people, a lot of it's just trial and error. Because I remember, 10 plus years ago when I started going dairy and gluten-free, I made it my first 30 days. And you're like, yeah, I made it 30 days. Feel great. But now I'm going to have my pizza.
Right.
And then it kind of snowballs. And then after a while, I was like, oh, wait, now my stomach doesn't feel great again. These things are starting to come back. I guess maybe I need to do this. And so then I'd be able to go 60 days. And then, you have your backslide. And it's just a period of trial and error as you're figuring out what new foods you like, what are better swaps. And then also a lot of it's just learning how it makes your body feel. And sometimes there's that trial and error period of it.
Yeah,
you kind of have to make yourself suffer. And then you eventually realize oh, okay, I'm making the correlation now to what I eat and how I feel.
Yeah.
And so now I can really make that choice of, is it worth it?
Yeah.
I know I'm going to feel this way, or no, I really don't want to have to deal with those negative symptoms. I'm going to choose to just not have the pizza or ice cream or whatever it is.
Yeah.
But then people that do truly have an autoimmune disease, rheumatoid arthritis, Hashimoto's, so autoimmune thyroid disease, Sjogren's, the whole gamut of autoimmune, I highly recommend the autoimmune paleo diet.
Okay, let's talk a little bit about that.
Yeah, it's a pretty restrictive diet because there's even a lot of spices that you have to cut out. Cut out coffee, all the nuts, all the nightshades. It can be pretty restrictive. There's still a lot of great things that you can eat, but it is a diet that's harder to follow long term. And most people, I don't think, need to follow it long term by any means. In some cases, people need to maybe follow it 6 months. Just depends on the level of inflammation and how much healing their body really needs to do. But it can be really helpful to find out what your specific autoimmune triggers are. I had a patient who had really bad arthritis in her hands and her joints, and she was a cleaner and too, so using her hands is very important.
Yeah.
So it wasn't something where she's like, I'll just deal with it. She's like, no, I really want to figure this out because it's part of my livelihood and my job. And she was doing all the right things, gluten, dairy free. And so I had her do the autoimmune paleo diet. And one thing that she would do pretty regularly was she would juice celery. And celery is something that you have to eliminate on the AIP diet. And that happened to be one of her big triggers. I mean, I never would have thought to tell someone like, yeah, let's just cut out the celery. I think that's gonna trigger your joints.
Yeah.
And so she found celery, and I can't remember which nut it was, if it was like cashews or almonds, but it was just one. It wasn't all of them. And so she was able to find very specifically what her triggers were. And so then she could make the choice of avoiding those things, or if she really wanted to indulge, she knew what the effect would be.
What the consequence would be. That's interesting.
Yeah.
I mean, at the same time, it kind of arms you with the knowledge to be like, okay, do I really want to go down this road or do I not?
Right.
And I think that's the most important part of like getting tested and then trying some of these elimination diets is at least understanding, you know, if it's worth it, right?
Yeah. And you get to learn your body and your body's response, and just gaining that knowledge, I think, is so worth it. And like I said, most of those diets from like, you know, being completely vegan, you know, there's many people proponents of that, and like no animal products. I think there's a time and a place for different diets, but I think it's just for the period that your body needs to heal and repair in that certain situation, and then slowly adding things back in. And if you're doing the things that your body needs to heal and repair, so like in autoimmunity, if you have an issue with your gut, are you taking the things you need to help heal your gut? Have you done any testing to look into that? Are you removing toxicity from your environment? Are you detoxing? Because then when you do those things, when you drain your bucket, as we'll say a lot of times, you talk about your body as a bucket, all the things we're exposed to, whether it's the food we eat, the air we breathe, and the toxins we can be exposed to unknowingly, the mental and emotional stress, the allergens, all of that fills up our bucket. And if you're doing the things to help drain your bucket, it's not going to be a big deal.
Right.
If your bucket gets clogged and congested, then it's going to overflow. Then you're going to have symptoms and you can have disease. But if you're doing the things to help your body heal and to help drain your bucket, eventually you're going to get to the place where you have a higher tolerance for maybe things that you didn't.
Right.
Like one thing I've noticed, like when I went through my mold detox, it was about a 6-month process. After that, I felt like I was extremely sensitive to mold.
Okay.
I mean, I think now, and sometimes I'm like, is it just PTSD from like the whole process of dealing with all of it? But I feel like I can very easily sniff out mold, or when things are musty and moldy, I can tell right away, like walking into a building or a hotel room. And back then, closer to when I first did my detox, it would really bother me and like set me off, and I'd get congested again and tired again and different symptoms. And so I'd kind of have to do like little mini detoxes and nasal rinses and things like that. But now, being so much farther out from that, not quite 10 years, maybe 8 years or so, I feel like my capacity for staying in a hotel room that's musty, I might get annoyed of like I wish, you know,
there was that. Yeah,
it wasn't like this. I wish they took care of these places better. I mean, I understand it's harder and it's costly and all of that. But I don't get headaches or certain things that I would when I would previously stay. And I think it's just, I've done a lot over the years to keep my body healthy, to do intermittent detoxes, to stay away from things that I know cause inflammation in my body. And I think that's allowed my body to heal and repair. Yeah. So now when I am around mold and it's a situation I can't avoid, like I'm okay. Like it's not going to set off a big flare up of symptoms or anything.
Absolutely. So take me through a little bit of what a mold detox would look like, because it sounds like, at least for you, but for a lot of people, it can be the biggest trigger into their autoimmunity and their kind of spiral into that. So what does a detox look like?
Well, one of the things too, along with besides just doing a detox protocol, is really making sure you're minimizing and removing your exposure as best as you can, which that can often be the hardest part. Not just logistically, but even like emotionally. Yeah. So like a lot of the things, because I mentioned the house I grew up in had a pretty big mold issue. So a lot of my childhood belongings and things that I had and pictures and stuff like that, I had to sequester them. And more recently, I've gone through and but I've just I scanned them all, took pictures of lots of things, and then I had to throw it away. Just because it's moldy and musty. And I'm like, I can't have this in my house. I'm not going to display it in my house. I'm not going to pass it on to my kids. Like, it's just kind of, it's, sort of ruined now, and you have to let it go. And that can be really hard to deal with that and go through that process. But especially for people that are very sensitive to mold, holding on to those belongings is just going to delay healing. And so, if it's your house that has had water damage, is there furniture that needs to be gotten rid of? Anything that's porous is going to be susceptible to being contaminated with the mold and mold toxins. And so there's the whole cleaning process, making sure it's properly being taken care of. And there's a lot of great resources out there on that. So that's a big step in it, is making sure you're staying in a place that is very minimal mold exposure, and you're not trying to detox when you're in a mold toxic environment.
Yeah.
And then mold, it will colonize when you're breathing it in. It'll colonize your sinuses and your GI tract. So doing nasal rinses, or at least like a nasal spray, if you don't think you can do the whole neti pot thing, can be an important part to make sure you're clearing out and killing off and removing any mold that's gotten into your sinuses, because that can then become a point of, if you've sort of done a more whole body detox, if you didn't clear out your sinuses, then that's just a point of continued exposure.
Right.
But taking things that support your liver, so liver support, glutathione is a big nutrient. It's a big antioxidant that our body uses to detoxification. So things like glutathione, liver support, milk thistle. We use the BioRay products a lot. So like Liver Life, taking some type of a binder that has like activated charcoal in it, taking a binder to help bind up the toxins. Doing a good multivitamin, a good B complex, making sure you're getting enough minerals. Minerals are really huge for detoxification. Minerals in our body, and you may have heard of, like, you want your body to be more alkaline versus acidic. If your body's pH is not at the right point, then you're not going to be able to get toxins into your urine as well, simply because of that pH and the pH gradient.
Interesting.
And so making sure you're getting enough minerals. There's actually a really great kit out there by Quicksilver Scientific.
I love Quicksilver, actually. They have great.
They have great products. It's Dr. Jill's mold detox kit.
Okay.
And it has kind of everything you need in it. And part of what they have are electrolyte packets that you take throughout the day that are helping you with doing that, getting your pH balance right so that you're able to detoxify. So focusing on those things. In some cases, so like when I did it, I took a lot of oregano oil and garlic, which are antimicrobial, antifungal. So trying to kill off and remove any mold that's in the body.
Yeah.
And depending on how you respond, depending on how long you've been exposed to mold, kind of how full your bucket is going to kind of depend if you need more or less. Like I really benefited from, going and even doing like saunas, doing red light therapy. Coffee enemas are another great way to really support your liver and speed up detox. So anything that's supporting your detox pathways, exercising, sweating, saunas, all of that is really important, staying hydrated. And it was about a 6-month process of taking supplements kind of in cycles, like taking them for a few weeks, take a week or two break, taking them for a few weeks, taking a break, and going through cycles. And the eye test that I mentioned at the beginning. So if that is something that you took and you failed, that is a great tool that's often used during sort of treatment, for lack of a better word, but during your detox, taking it every 30 days to see how it changes and improves. Sometimes it gets worse before it gets better, and that's like your body's kind of getting rid of a lot of stuff. You're having the inflammation from that. But then as your body clears it out, things start to improve. So that's a good gauge of how your body's handling the detox protocol. Do you need more? Do you need less support to kind of help get everything out of your system? Yeah,
that's really cool that you can just kind of get a good gauge, middle of the road on where you're at and how these things have been affecting you. And it makes sense, because even like myself, and I know the other doctors on staff, when we're treating a patient chiropractically, which is a combination, like when someone has autoimmune disease, when we talked about this last time, that getting adjusted and helping, stimulating your immune system can absolutely help in that healing process. But I always like to tell people it's like peaks and valleys. Like sometimes, you're going up these steps and you get to a landing. And that's kind of where I described some people are like, well, yeah, I feel better, but I'm still hurting. Or like I had a little bit of a flare up before, and
Yeah.
you have to bring it back down to be like, well, do you remember how you felt when you first started?
Yeah.
And we're at this landing of in the staircase and not at the bottom like we were before. And sometimes it takes a little bit of time to be able to keep landing or at that spot. And then, we're just keeping going on the path and the trajectory, and we get to the top and we're like, oh my gosh, look at that. Like, look at how much better I feel now in comparison to whenever I started. And that kind of resonated with me a little bit as far as with an autoimmune journey, because it's almost never linear in terms of who I've talked to and the patients we've co-managed together, being like, it's great. And it's been difficult along the way.
Yeah. You always have those ups and downs, and you're right. It is keeping that perspective of like, all right, what was it like before I started all this, before I started on this journey, and looking back and reminding yourself that, it's going to take some time. And two, talking about a detox protocol and things that are helpful, chiropractic care is also very important, because when you're pushing your body through that, you can be getting more into that sympathetic fight or flight mode sometimes, just with what you're putting your body through to a degree. And getting chiropractic care helps to kind of keep the nervous system where it needs to be, so you can handle the detox process better and not feel so stressed.
Exactly.
Because when your body's going through physical stress, we need that support, even mental and emotional stress. All of that is pushing you into the sympathetic. That's where adjustments are helpful to kind of pull you back out of that.
Exactly. People can be super sensitive to input, and that's another thing that I say all the time. I'm like, people that maybe are dealing with autoimmune disease can be super, super sensitive physically too. So it's all about understanding that someone can be very sensitive to that neurological input, and just like calming things down, letting things kind of go.
Yeah.
But no, that's awesome. And then you also mentioned some like exercise and stuff like that. So I kind of talked a little bit about how important exercise was whenever we chatted on our last episode, but why maybe some super intense exercise might be a little bit not the way to go initially, right? So let's talk about that too, because any exercise is good exercise is what I tell people, especially if you're sedentary.
Yeah.
But how can it trigger some autoimmune responses if you're already overloading yourself with all these different changes?
Yeah. I mean, when your system's already overloaded, and so you're already putting that stress in your body, and like we talk about like sympathetic fight or flight, when you're already going through a lot of change and your body's trying to adapt to that, sometimes then going and doing like a hard HIIT workout or CrossFit is just going to add to the stress that your body is dealing with and trying to calm down, and it's not going to help your body heal and repair.
Yeah.
Yes, we say, we want you to sweat, but then there's also other ways to sweat. Like you can go to the sauna. So if you're at the point where, and to a lot of people sometimes with autoimmune, fatigue can be a big issue.
Huge.
A huge
I
issue.
hear all the time.
So doing high intensity workouts may not be even feasible just with where their capacity is at. So if you feel like you're able to do some exercise, but you're like, well, I want to sweat and get that detox effect, that's where going to like an infrared sauna, if you can, doing things like that to get your body to sweat in less intense ways can be beneficial, because just that physical activity and that strain on your body can just prevent healing and repairing, because you're just adding to that stress, that load, that, pushing you into fight or flight, where your body can't heal and repair when you're in fight or flight.
Yeah.
Because that's not, your brain and your body is not thinking heal and repair when you're in that mode. So you've got to try and do all that you can to get your body into that rest mode.
Yeah. So give me a good example. Like, what would you recommend someone to do in terms of a form of exercise? I'm big into getting people to do like more strength training.
Yeah.
Tell me what you think.
Yeah. I mean, I think strength training overall is super important. I don't think people put enough focus on that sometimes. But as we age, we need that muscle mass to keep our metabolism up. We need it to support our frame, to prevent us from injury.
Yeah.
And it can be a lower intensity way that is still getting your heart rate up and getting a good workout. So I think weight training, if you have the capacity to do it, is great. And even just if, depending on where you're at with weight training, just doing body weight.
Yeah.
And, in the day and age we live now with like YouTube, and there are so many great videos.
So accessible.
So if you're an at-home workout type person, it's so accessible to type in on YouTube like body weight at-home exercise.
Absolutely.
Or whatever type of workout you're looking for, it's going to be there. And so even just starting with short bits, another thing I think people get hung up on with exercise, and I've struggled with this, is having the mindset of, oh, I'm gonna exercise today. Okay, I have to have an hour to like do my workout, do stretching, do this, got to shower. Like you feel like you have to have all of this time to do it, where it's like, okay, do I have time to do 10 minutes of movement? Okay, yeah, I could do that. Like doing that 10 minutes of movement is so much better than doing nothing. And usually that snowballs into, you realize you have the capacity to like, oh, I could do 15 minutes. Or, oh, actually, I could do a 30-minute workout this day. But sometimes I think we let that mental block of like, I don't have enough time.
Yeah.
But it's like, no, even just stretching for 5 minutes is better than just like
than doing nothing,
laying in bed for an extra 5 minutes.
Yeah.
So it can be hard to get out of bed sometimes, but
It
even
is.
just that little bit, I think people would be surprised if they made that little step of like, I'm just gonna do 5 minutes and see what happens. I think they'd be surprised at the difference that they feel and notice, even just with doing that small amount.
Yeah, no, I completely agree. And that's something I'm like, I always tell people you need something digestible to be able to start, because that's without starting, you're never going to get anywhere. So that is a huge roadblock for a lot of people.
Yeah,
because they're like, it's not good enough. I'm like, well, it's better than doing nothing, which is where you've been for the last 10 years of your life, right?
Yeah.
So that's good. And that's great comprehensive advice in terms of people that do have autoimmune disease as well. That was like amazing in terms of like all the information that we've gotten for autoimmunity. What would be like 5 to 10 takeaway steps for people that are like, oh, that kind of sounds like me. Like I have migraines, I have fatigue, I have, whatever it might be. What would you say are your biggest take homes from this episode, and what to do in terms of testing, nutrition, exercise, all those things?
Yeah. I mean, I think if you feel like your health is struggling, I mean, even if it's not autoimmune, but for most people, if there's something chronic that you've been dealing with, I would first try to start with looking where you can make some little changes in your nutrition. Drinking more water, looking at dairy and gluten. If you can cut them both out in the same 30 days, I think that's great. If that is too overwhelming for you, then pick one. Cut out one for 30 days, see how you feel. And then, the next 30 days, or pick another time down the road to cut out the other one and see how you feel. Looking at the toxins in your environment. So starting to go down that path. How's your water filtered? Are you trying to get organic produce when you can? Looking at like the Clean 15, the Dirty Dozen guide. What's your cookware, bakeware like?
Yeah.
Those are kind of important first lifestyle steps. Because for some people, especially with some things like certain GI issues, things like that, and even autoimmunity, like gluten can be such a big trigger. And if you haven't cut out gluten already, like starting with those things, because you might be surprised how big of a change that it makes. And then if it doesn't really make that big of a change, looking at considering either doing like a gut cleanse, which that's something we can walk you through at Revive Chiropractic.
Absolutely.
I would not just recommend that you go out to there's, lots of marketing out there now for supplements and these protocols.
Yes.
Not just do any gut cleanse.
Get guidance.
But get guidance with that. You can even get ultra-specific guidance in by doing a stool test, like what we do at Revive, and that would let us know specifically what your gut health needs. So considering starting with your gut, it's usually the place most people need to start.
Yeah.
The VCSI test, that is a great at-home test. I'm sure if you Google it, you'll probably find a link to it. Survivingmold.com is one website that has the eye test on there. If you take it and you fail it, then that's a good indication. You might want to reach out to someone like me at Revive Chiropractic to try and go through a mold detox protocol and look into that.
Yeah.
evaluating your exercise. Are you over exercising for what your body can handle right now? Looking at your general load in life anyways and seeing, okay, am I pushing too hard in general? Are there things I could cut back on because I need to focus on my mental well-being, which is going to help my physical well-being, those sorts of things. But I think looking at it in baby steps too, depending on where you are. Some people are like gung-ho. They can just dive right in, change it all. But if you're the kind of person where you're like, this is a lot, this is, not a path I've started to go down before, start with the baby steps of looking at your nutrition and even breaking it down into, okay, I want to cut out gluten. If it's too hard to do that altogether, just start with breakfast. Then once you have breakfast down, go to lunch, and you can really chunk it up.
Yeah.
If they feel like you need guidance with all this, I do consults at Revive just to kind of put these simple plans together and help walk you through that.
Yeah.
But yeah, I think focusing on the nutrition, cutting out gluten and dairy. If you've done that, you can find the AIP diet online and even start that yourself and see how that helps to improve your symptoms. Evaluating your exercise, backing off where you need to, looking at toxicity, maybe take the VCSI test, consider GI testing or addressing your gut health. Those are kind of the 5 things that I would recommend starting with.
That's awesome. Well, thank you
Yeah,
for everything.
of course.
I feel like this really, I learned a lot, so that's cool. Gave everybody kind of a bigger idea on, we understand what autoimmune disease is, and now how do I take my steps in order to help myself heal? So thank you so much for coming on to the podcast.
course.
It's been absolutely wonderful.
Yeah, great to be here. Thanks for having me.
Absolutely. All right. So that is the end of this episode, and join us next week on our next podcast.